right, hello everyone and welcome to the National Board of Forensic Evaluators webinar entitled COVID-19 Resources for Mental Health Professionals. My name is Aaron Norton and I am the Executive Director of MBFE, and I'm going to be one of your presenters today. And we also have Ekim Essian on today. He is our Southern Regional Director for the National Board of Forensic Evaluators, and he'll be chiming in as we go through some of this information today as well. The National Board of Forensic Evaluators is an organization that partners with associations like the American Mental Health Counselors Association and several state and local organizations as well. And we're providing this webinar as a resource for mental health professionals during this very difficult and challenging time to help people to prepare for and to respond to the current pandemic and the different ways that it will impact and is impacting our profession, our clients, and really the entire world today. And a quick note about the National Board of Forensic Evaluators: we exist to train mental health professionals who are interested in the specialty credentialing or the specialty area of forensic mental health. We are a national not-for-profit charity, and we provide or we manage the Certified Forensic Mental Health Evaluator credential, or CFMHE, as well as the credentials Certified Forensic Behavioral Analyst and Certified Child Custody Evaluator. We are the only national organization that is officially endorsed by and partnered with the American Mental Health Counselors Association to certify mental health professionals in forensic mental health. And if you're interested in hearing more about us, feel free to visit us at nbfe.net. And that actually brings us to our first polling question. All right, looks like we have a great deal of members of the American Counseling Association. And we also have a pretty good representation from the American Mental Health Counselors Association, the National Association of Social Workers, and a few folks probably from the American Society of Addiction Medicine. And our second polling question is about your professional identity. All right, looks like the majority of you are counselors, but we also have some social workers and some students represented today. And then our final polling question before we get into the slides. Right now, given the current pandemic, are you providing clinical services A, in person only, B, through telehealth only, C, in person and through telehealth, or finally D, not applicable because I'm not seeing any clients right now? As you can see, it looks like the majority of you are providing telehealth only. Currently, about 65% of you, as the numbers keep coming in here. But also 13% are providing in-person and telehealth, 9% are providing in-person only, and then 14% of you are not seeing clients at all. It's interesting because the first sample that we did last week, 50% of counselors were still seeing clients in person. Now, if you combine A and C together, it's only about 24%. So it has reduced in half since we started doing this polling question last week. And that tells you maybe how rapidly things are changing out there. All right, so let's jump into it. First 30 minutes, we're going to cover some pertinent laws and executive orders, precautions for in-person contact with clients for the quarter of you who are still doing in-person contact, how to transition to telehealth, how to help clients during a pandemic, and how to stay updated because, as you all know, there is an awful lot of information out there and an awful lot going on right now. In the second 30 minutes, we're going to be collaborating. You're going to be able to freely answer or ask questions and share some ideas and resources as well. First thing I want to cover as far as laws and rules go is that many of you saw the announcement from the Office for Civil Rights, or the OCR, under the U.S. Department of Health and Human Services. And they essentially said that although it is still technically not legal to provide services through a non-HIPAA compliant telehealth platform, they are temporarily going to not be enforcing non-compliance or enforcing compliance for professionals who are acting in good faith during a public health emergency. Okay, so people have interpreted this in different ways. And my recommendation would be that you still use a HIPAA compliant telehealth platform for several reasons. One reason is that announcement from the OCR in no way has any impact on state laws and regulations. So it's still illegal both under federal and probably in your state law to use to not be using appropriate technologies for telehealth, in addition to the fact that it could get you into trouble with your licensure board. And when you really read their announcement, it really implies that what they're saying is if you're in a pinch and it's emergency and you have no other options, then it might make an awful lot of sense, or and under those conditions, then we'll kind of look the other way for right now temporarily. But the
Wanted
reality
to
is,
add, if you don't mind, Aaron,
yeah,
I
sure, go
wanted
ahead.
to add, hello everyone, that it may also not free you up from any civil litigation if if their information is compromised. So, best practice.
You're absolutely correct, Ekim. I'm glad you brought that up, because this also doesn't impact something like a malpractice case where a client could allege that you had a duty to them and that you breached that duty by not following a good practice, and because of that, harm was caused to them. So that's another great reason to not be using a non-HIPAA compliant platform like FaceTime, for example, or the non-HIPAA version of Skype, or the free version of Doxy, and that sort of thing. You do have free HIPAA compliant options available to you, so I recommend using them. An example of such a resource is Doxy. Doxy.me is the website, and you can get a free HIPAA compliant account with a signed business associate agreement, or you can spring for the pro plan at $35 a month so that you can do group sessions, 3 to 10 clients, and get higher quality connectivity. Now, I will also tell you that we were getting reports from mental health professionals nationwide a couple weeks ago that they were having some connectivity problems with Doxy, as Doxy struggled to keep up with the demand of all of the new healthcare professionals accessing their resource. But we were not hearing that from the people who had pro plans with the superior technology at $35 a month. And also the people with the free plan have been reporting to us in the past week or so they have not been having any issues. So hopefully those bugs have been worked out for now. Okay, now the other point I want to make about this is that we really ought to be thinking more long-term. And so I think in terms of telehealth, you want to have a platform that will accommodate social distancing for much longer than some people are thinking about. Now, I'm no epidemiologist. I'm not a biomedical professional of some kind. I have no idea what's going to happen with this virus. What I can tell you, though, is that I repeatedly am hearing and reading from authoritative sources that a vaccination would not be available until roughly 12 to 16 months from now. And there's speculation that the virus might be seasonal, but that's just speculation, and many people are not buying into that. So we might want to think about this social distancing as potentially being something that will go on for 12 to 16 months or longer, maybe even a couple of years. And I hate to say that, but I think it's important to be prepared for those worst outcomes. And if you get the appropriate infrastructure in place right now for telehealth, early on in the game, I think that'll make things easier for you. So I'd recommend getting an appropriate platform. Okay, so are mental health professionals considered to be essential workers? We should have launched that as a polling question, but the answer is yes. I've never seen any authoritative resource indicate otherwise. So as we see various safer at home orders, executive orders, et cetera, issued state to state, county to county, and by municipality, we will see that most of those orders you reference guidelines created by the US Department of Homeland Security, which in their list of essential workers, they include caregivers such as psychologists, mid-level practitioners, social workers, community mental health, etc. So very clearly, they cover licensed mental health professionals as an essential worker, meaning that if you chose to, you should be able to, unless your state or municipality or county indicates specifically otherwise, you should be able to still go to work, go to your office, even if you're not seeing clients there. And then some people have said, well, what happens if you get pulled over or something like that? And I don't know, different states are different. In Florida, when we renew our licenses, we get a copy of our license, but we also get a card that shows that we're a licensed healthcare provider. Which can be shown in an event like an emergency situation to verify that we are indeed healthcare professionals.
And you can do the same in Georgia. You would just need to go to the Secretary of State website and you can order a wallet card. if you don't already have it.
Wonderful. All right. Now, as an example, I gave you Florida's executive order, and they use the same requirements as the U.S. Department of Homeland Security. We're seeing that pretty much across the board. That doesn't mean you should go to work necessarily, but you are an essential worker. Now, for those of you who are SAPs, substance abuse professionals who conduct evaluations for U.S. Department of Transportation violations, you may know that federal code requires the evaluation to be conducted face-to-face and in person, and they specifically prohibit telehealth or webcam-based or telephonic evaluations. As far as we can tell, that still is true, even during the current pandemic. According to the American Substance Abuse Professionals, and then also the Department of Transportation recently released an advisory, and the only thing they even said about SAPs was nothing really changes for you, but you should follow your state and local recommendations. Well, at first you might say, oh, well, then that means I could maybe do it through telehealth because maybe in my state or my locality, they're recommending telehealth or something. But actually, if you look at every executive order, pretty much they called mental health professionals essential workers. And if you look at CDC and World Health Organization, they are providing recommendations for still providing services in person and how to do that. So I don't think that, I would not interpret this announcement as being that you can now violate that federal code. And that's only for SAPs conducting DOT evaluations though. You could, of course, though, say that you don't want to do any DOT evaluations at this time, and you can just stop doing evaluations. That's certainly an option, but if you are, then as far as I can tell, it still needs to be in person, unfortunately.
Well, and if you consider that you typically the substance use evaluations, a component of that is the drug screening. You know, if that's going to be administered, you generally need to be in person. Technology hasn't gotten us to the point where we can get those samples remotely.
Hello, everyone. Just a quick update. The day after this live webinar, we received new information indicating that SAPs, substance abuse professionals who provide Department of Transportation substance abuse evaluations, are now allowed to provide remote services for assessments and evaluations as long as DHHS determines that there's a public health emergency, or June 30th, 2020, whichever is sooner. There are some guidelines that have been offered for these evaluations so that they can temporarily not be conducted face-to-face. The technology has to use a real-time two-way audio and visual communication interaction between you and the employee. You should determine if the quality of the technology is sufficient for you to gather all the visual and audible information you'd normally observe in an in-person face-to-face interaction. And finally, you may only utilize the technology if your state-issued license authorizes you to do so and within the parameters of that authority.
But I also wanted to add, there are some other modalities if you're doing treatment that typically don't work using telehealth, and it's not recommended to do trauma processing of the traumatic event because for fear the patient or client may get upset, leave the room, and those are things that you can't control remotely. And even working with young children, if you do play therapy or use interventions in that area, it's really, it's impossible to do that remotely. So
Yeah, absolutely. There will be many scenarios where it wouldn't be clinically appropriate to deliver treatment through telehealth means. Now, if you are still seeing clients in person, then here are some office precautions which come from resources like the World Health Organization and the CDC. First thing though is I do recommend transitioning as many clients as possible to telehealth. I am one of those clinicians who is still seeing clients in person, but very rarely. In a typical day, I might see one person in the office right now, and with tremendous precautions in place. I've transitioned as many clients as I can to telehealth and am going to continue trying to move clients to telehealth. But if you are still seeing clients in person, if you're making that choice, then some precautions could be to only allow one client in the building at a time, Make hand sanitizer available to clients when they enter and before they leave. Sanitize all commonly used surfaces in between each appointment, perhaps wearing disposable gloves that are appropriately discarded. Keep all chairs more than 6 feet apart and never come within 6 feet of a client. Of course, that means you're never shaking hands with a client, touching a client, or handling anything that the client has touched or will touch. Remove all magazines from your waiting room, or really any surface that you can remove, and then replace office paperwork with online forms. The rationale for some of these precautions is that COVID-19 is transmitted through droplets. So if a person is carrying the virus and they cough or they sneeze, for example, those droplets will tend to rest to a surface within a 6-foot radius of the individual. They will settle on whatever surfaces are nearby, or the person may have droplets on their hands, or another person may walk up and touch a surface that has droplets on it where the virus is still active. And then they can transmit those droplets to somebody else through hand contact. That's why we want to be very careful about hand washing. We want to be very careful about any surfaces that other people have touched and be constantly sanitizing all of those surfaces. So if I have a client come into the office, then I have already, yeah, there you go, Ekam. It's we all have, I have like my disaster, toolkit here that I walk around with me everywhere. And basically, if a client comes into the office, we've already sanitized all the doorknobs, all the handles, whatever chairs, everything. If they sit in a chair, the chair has to be thoroughly sanitized afterwards. We're taking extreme precautions in our office because we obviously are taking this very, very seriously. So if you were never touching anything that a client has touched that hasn't been sanitized, and you're never coming into within 6 feet contact of a client, it'd be very, very hard, I would imagine, to get the virus. But the bottom line is, as long as you're choosing to have in-person contact with other people, you are accepting, though, the potential for transmission, and that's important to consider. Some additional strategies are to have your office staff work remotely. So in our small group practice, clients would leave their session and they'd sort of sometimes be lining up to the checkout desk to be checked out or schedule their appointment or make a payment. Well, that's a bunch of people congested in a small area. We don't have that anymore. Our office staff are working remotely. Clients are doing their transactions online. They're doing their paperwork online. They are coming in without any paperwork. They don't need to pass anything or touch anything or come into contact with an office worker anymore. The office workers are answering the phones remotely. There's no need to have all of that extra exposure because of the technology available to us. Using online scheduling and payment systems, washing your hands every hour. So I wash my hands every hour, regardless of whether I have touched something that I think somebody else could have touched or not, because I'm in the habit that if I'm going to be at work, there's going to be an hourly hand washing. That's a habit that I've gotten into now that I'll continue to practice as long as we're social distancing and as long as I'm still seeing people in my office. You can check and track your body temperature daily. I check mine twice a day and then I log it in. You can, of course, practice social distancing outside of work as well to minimize the potential that you will be getting the virus and then bring it into work with you. And you can post signage indicating that clients should never enter the building if they've experienced fever, cough, or shortness of breath, the 3 primary symptoms that we'll see with COVID-19 exposure, if people are even symptomatic, because as you know, many people are asymptomatic for a period of time. And instead, they should call their physician and then call your office after that to discuss telehealth options. I would recommend being more flexible than usual with late cancellation fees, because you'd rather have a client call you a few hours before an appointment and say, I'm not going to come in because I'm having some kind of a symptom or I'm coughing a lot or something, than have them come in because they don't want to have to deal with a late cancellation fee. I'll talk briefly about transitioning to telehealth. We talked about the importance of an appropriate platform. These are all platforms with hyperlinks that do have HIPAA compliant versions. We've already talked about Doxy. Regular Zoom accounts, free Zoom accounts, for example, or even the Zoom Pro account, they are not HIPAA compliant. And you have to get Zoom for Healthcare. If you go to Zoom for Healthcare's website, you will see that the lowest plan starts at $200 a month and gives you 10 licenses. That might be great if you had a large practice with a lot of clinicians. But if you're a solo practitioner where you only have a couple or a few clinicians in your group practice, then that seems like an awfully expensive monthly fee. However, if you contact Zoom and you tell them,
Aaron, if you wouldn't mind, if you could backtrack, you froze on us.
oh yeah, there we go. Yep, it happened. All right. So just so you guys know, about every hour I lose internet connectivity for about 20 seconds. I think it's because everyone in the world is using the internet around us right now. I'm not sure what's going on, but so I was talking about appropriate platforms, and the free version of Zoom and the Zoom Pro version, they are not HIPAA compliant. If you go for Zoom for Healthcare, if you look online, you'll see that the plan starts at $200 a month, and it contains 10 active licenses. That might be great if you're a group practice or an agency, but if you're a solo practitioner or you have a very small group, that's kind of cost absorbent. If you contact Zoom and you tell them, look, I'm a solo practitioner, or I don't need 10 licenses, I need 3. Then you can get them to give it to you for $100 a month with 5 licenses, which is what we did in my small practice where we only have 5 clinicians. And then, it's $20 each. Or even if you were solo and you wanted Zoom, that's $100 a month, and that's better than $200 a month. We've never heard anybody get it cheaper than $100 a month, but everyone who's tried to get it for $100 a month has gotten it that I've spoken to so far, and I've spoken to a lot of people. So GoToMeeting, the regular version is not HIPAA compliant, but you can get a HIPAA compliant version. The same for G Suite. Simple Practice is an electronic practice management system that has a telehealth option. Therapy Sites, if your website is a Therapy Sites website, they have just announced that they will give you their e-health platform for free temporarily. And VC is another commonly used platform. Now, if you select a platform, your clients have to know how to use it. So your clients need maybe links or tutorials or information on how to appropriately use the technology, and you have to create a telehealth consent form. I recommend reading Section B6 of the AMCA 2020 Code of Ethics and Section E of AMCA's Standards for the Practice of Clinical Mental Health Counseling to know about all the things that you need to be knowledgeable about with telehealth, and then of course complete a telehealth training program. And I will show you some free programs that you can take right now temporarily because of the COVID-19 pandemic. We'll get
So
to
really
those.
quickly,
Sure.
just to make sure everyone understands, it's not HIPAA compliant if you don't sign a business agreement. So making sure that whichever platform you use, before you've paid your money and signed up, to make sure that you read the business associate agreement, that's what ensures that you are HIPAA compliant. And well, I just lost my train of thought. Continue, and I'll catch up with you.
Yeah, sure, no problem. You're absolutely right. You even if you get a HIPAA compliant platform, you must usually request the business associate agreement and have that signed, have it in your hands or saved on a file on your computer so you can prove that you are complying in that sense.
And I'm just seeing a question here. Someone typed into the chat. Will this training count towards NBCC CE hours? So before we get to that, well, Valentino's answered it, but I wanted to say that at least in Georgia, you're required to have 6 CE hours of training before you are legally, by the board standards, able to use telehealth. So, and there are a variety of numbers of trainings. I know that LPCA is doing a number of webinars, I believe on Fridays, offering the telehealth trainings.
Yes, and MBFE is an NBCC approved education provider, so we can provide CEs for folks who need NBCC approved hours. So now insurance gets a little tricky here with telehealth. I always tell my clients, contact your insurance company and verify that you have telehealth coverage for psychotherapy and document that phone call, who you talked to, when, what they said, etc. When you submit a claim, you bill with location code 02 for telehealth instead of code 11 for in-office visit. You would use the same CPT codes as usual, but you would add a modifier that would either be GT or 95, depending on the insurer. Now, there's a lot of stuff out there on which code to use, and I wish I could give you a simple rule. I can tell you, for example, Simple Practice, they say you use 95 for commercial insurance and GT for Medicare. Well, I can tell you already that there are insurers that want GT that are commercial, like some United plans, for example. Um, the American Academy of Pediatricians says use GT only when directed by your payer to not use 95, so default to 95. Now, both of those modifiers mean that you have both audio and visual contact with the client. So you have to have video and audio, webcam in other words. Most insurers do not cover telephone sessions. There are some exceptions we're starting to see, but the majority do not. So you want to make sure you can't bill a 90834-95 if you did a phone session, because you're lying. You're committing insurance fraud because you don't have video contact. You can't see the client. So understand, I know that sounds like a simple mistake, but people have lost their licenses and been criminally prosecuted for saying that they did an in-person appointment using code 11 instead of code 02 for telehealth. It's considered insurance fraud. So please keep that in mind. We also, what if my client crosses state lines? This is also a constantly evolving question because many states are creating temporary exceptions. You have to know that you are following both the laws in the state that you are licensed in and the state that the client is physically in, regardless of what some people say, oh, it's where the client legally resides. That's not true. If your client's in Hawaii, but they live in Florida, but they're in Hawaii right now, you have to follow Hawaii's laws because you are now providing a service to someone in their jurisdiction. That's also outlined in the AMCA Code of Ethics. And because there are 50 states, there are so many different laws and rules out there governing telehealth. So my primary recommendation is to download the free telemental health app, which there's a link for here at the bottom of this page, or you can simply, type into Google telemental health app, and you'll probably pull it right up. And this app, if we have time in the second half, I'll show you it. You go to this app, you choose the state that your client's in, like say they're in Georgia, you click Georgia, then you choose counselor if you're a licensed counselor, psychologist if you're a psychologist, etc. And then it gives you a few options. One of them is laws and rules. You can click there and find out do they have any laws or rules specific to telehealth? And if so, what do they say? Some states say, you know what, if you're licensed in Florida, like West Virginia, for example, you can do telehealth with people who are in West Virginia, but no more than 30 days in a calendar year, or you're in trouble with us. So there are little weird laws and rules from state to state. And the only way to know is to research the laws and rules for that state, the client's physically in, as well as your own. And then there are executive orders coming out all the time that are creating exceptions right now. Now, I mentioned paperwork. We don't want to be having clients hand in paperwork right now, right? They hand in a paper packet, I handle it. There could be droplets on that packet, and then I can take those droplets, get them into my nose or my mouth or my eyes or something because I'm scratching my face or something, or pass it on to some other surface or person. So have them do electronic forms and make sure it's a HIPAA compliant platform. Now I contacted SurveyMonkey because I love SurveyMonkey, and guess what? $10,000 a year to be HIPAA compliant. No, thank you. Not going to be able to do that. So then I looked at other options. JotForm was providing a HIPAA compliant system for $35 a month with lots and lots of great templates. So I bought a year of that. And then a few days later, they announced, oh, guess what? We're giving it to everyone for free because of the COVID-19 pandemic, the HIPAA compliant plan. I just missed the boat on that one. So fortunately, you can click on, or you can Google JotForm Coronavirus Responder Program, or click on this hyperlink, and then you can do a very quick application. All you have to do is be able to explain how using their HIPAA compliant system will enable you to provide services during the pandemic. So you just say something like, I need to transition my clients away from paper forms to electronic forms in my practice or clinic to reduce possible COVID-19 exposure and to facilitate telehealth or something like that, and then submit it, and then you'll get a free HIPAA compliant plan. I have built all kinds of wonderful forms because they're easy. I have my client intake form. I've created daily mood charts. I've created relationship check-ins, the mother of all thought records, all kinds of great things for clients to do while they're social distancing. And then it sends me notification when they submit things, which I put into their electronic record. and then we can discuss some of those things in sessions. This also gives them a way to be doing something between sessions. Now, because insurance companies, some policies cover telehealth and some don't. AMCA and many other organizations have been advocating for insurance companies to create a temporary across the board, clients can use telehealth for psychotherapy, whether it's on their plan or not. There's only one insurance company I've seen so far that has said that they'll do that temporarily, and that's United. And that may only be for my state, I don't know. But I will show you how you can get updates on what the different insurance companies are doing as well. Now, also, if you think about the long haul, many of you are noticing that maybe you have less business than usual. I'm fortunate in that I still have tons of business right now, but I know not everybody's in that same boat. You might want to consider joining some of these online counseling systems where all of the clients who use these systems are only interested in telehealth, and that's why they're going to these systems. And here are examples of some of those systems. Now, it can take a while to get credentialed for any of these, just like it can for insurance. So if you think you're interested, I would start applying now, because it could be, a couple months or a few months before you get in. And we might, again, want to be thinking about the long haul here, because I think, personally, I believe we might be social distancing for quite a while. And if we don't, that's nice and everything, but we just don't know right now. Now, Ekim was talking earlier about when telehealth is contraindicated. Some clients don't have internet access. I'm surprised to find that some of my clients do not. I kind of assumed they all did. Some struggle to use technology because of cognitive impairment. Some don't trust telehealth. Some are just uncomfortable with it. Some do not have the appropriate equipment. Some lack privacy in the setting they're in. If you have a client who's in an abusive relationship, then she's not going to, he or she would not be sitting there at home, maybe doing a telehealth session when their partner could walk in on them or be in the other room listening, or through the door or something along those lines. Some are not very tech savvy, and some don't have telehealth insurance benefits. So these are all things to be considering. And as you do more training in telehealth, you'll learn all about some of these nuances. What if you have a client with OCD and they were maybe working on their excessive hand washing prior to the pandemic? Well, the International OCD Foundation created a great website full of information for such clients to help them to differentiate between what is a reasonable precaution as recommended by authoritative sources like the CDC versus what might be something that is not particularly rational or helpful and could actually be exacerbating their condition. So encourage reasonable, not unreasonable precautions. Social distancing doesn't have to mean social isolation. So I have clients who are doing very creative things right now. Clients are doing online gaming with friends or family. I had a couple that they got virtual reality headsets so they could still go to movie theaters virtually as avatars and even invite their friends, and they're all safe in their own homes, social distancing, but their avatars are all hanging out in this virtual reality world, and they're watching a movie in a movie theater together, throwing popcorn at the screen. So there are all kinds of creative things that people are trying to come up with. No gyms doesn't mean no exercise. So I have clients who are very bummed out about losing their exercise regimen that they've been using for mood maintenance and other goals. So I'm having them do things like Google the phrase hotel room workout, how to do a full body workout with common household objects if you don't have equipment at home. You can still go outside, like here in Florida, for example, you can still leave your house and go outside to exercise, provided that you are social distancing, which means if you're going to go for a jog and there's somebody else on the road, that you're not going to come within 6 feet of them. And you're not going to be touching or handling anything outside that somebody else could have touched or handled. And you're certainly going to be washing before and after, and et cetera. So I have a client, we live on the water here. So I have a client who he's been traveling so much for work, he never has time. So now he went and bought a paddle board, and he's paddle boarding for exercise and finding it very relaxing as well. And he doesn't come into contact with other people when he does it. So quarantine can also be a personal renaissance. People are getting in touch with things that they've been out of touch with. They're getting to that reading list they haven't gotten to. They are, I have a client who said, my girlfriend, Yes, New Year's resolutions, they're happening in April or whatever month it is right now. Um, I have a client who said his girlfriend bought him an art kit for Christmas that he hasn't had time to open. Now he's opening it and he's doing some artwork. So help your clients get in touch with their personal renaissance when they're social distancing. Telehealth is better than no help most of the time. I'm not going to say always. So clients who, I'm not really comfortable with telehealth, well, maybe it could be therapeutically appropriate for them to give it a shot, try it out for themselves and see if it's as bad as they thought it would be. And do they find it more helpful than not doing sessions at all while social distancing? Some jobs are receding, but others are expanding. So some of your clients have lost jobs. Helping them to identify the jobs that they can do while social distancing can be helpful. And then for clients who are lacking structure, they're bored, they're out of their routine, they're getting dysphoric, I've recommended a practice. And the practice is each day, get up and create a plan for the day. And it's going to vary from client to client, but I usually recommend include in that plan something relaxing, something, or for some clients, more than one something that's productive, something that's social, something that's entertaining, and maybe something that's meaningful. It's a simple practice every day because if a client's making a plan for the day and it's a healthy, well-balanced plan of activities with relaxation worked into it, and then they're accomplishing those things, they can still have that sense of structure and accomplishment that tends to support wellness. Now, how to stay updated. If you are a certified forensic mental health evaluator, or you are an applicant or a candidate for the CFMHE credential, then you have access to our online forum. And you will see that we've created a thread of COVID-19 resources that's quite robust. And we're adding to that every few days any new resources or information that comes in. Everything in this slide is on the forum. Now, if you're not connected to our organization, but you are connected to a partnering organization, take the American Mental Health Counselors Association, for example, use their online community. They have an open forum and it has several COVID-19 streams. One is COVID-19 resources for counselors. Another one is COVID-19 and insurers, where people are posting information they're getting from the insurance companies. If you use the MBFE forum, then make sure you go in and subscribe to the Daily Digest by hitting the subscribe button. What that will do is no more than once every 24 hours, you will get an email, and that email will notify you of any new posts that have come up in the forum and then in a digest version. And then if you want to read more, you can click on it and go to the actual forum page and read some more information. Because if you're like me, your email inbox is cluttered and inundated right now with tons of information, and you might do good for having just one email a day about updates. And if we don't get to your questions in the next several minutes here, then feel free to post your question in our online forum. Or if you have questions about the content we covered today, feel free to email me at aaron@mbfe.net if you're not a member and you can't access our forum. And with that being said, let's move into your questions. I'm going to open up the chat box. I bet, and I'm just going to start at the top here and kind of work our way through and see what all we have. So some people are saying that some of those telehealth resources pay very little. I have to agree with you. I kind of consider that a last resort for if I've got all these open slots in the schedule, I'd rather make, say $50 than $0 maybe, but I am trying to avoid those resources for that reason. Let's see what else we have here. Did you cover the issue about insurance providers giving the okay to use telemental health? Yes, we have covered that. It varies from policy to policy. I recommend your client contact the insurance company, and if you have the time and or office staff to do it, have your office staff contact the insurance company to verify, A, does that patient have telemental health for psychotherapy as a benefit? And then B, how does that insurance company want you to bill it? Do they want you to use the 95 modifier, or do they want you to use the GT modifier? Let's see here. So somebody has posted a website called Adaptive Telehealth that offers great features, including HIPAA-compliant videos. Okay, that's interesting. I've not heard of it. We already covered about CEs. Typically, it's Oh, this was a comment from you, Ekim. Typically, it's up to the prisons to decide whether or not they will allow for telehealth assessments. Okay, so somebody asked the question, I suppose, about forensic evaluations. Ekim, would you like to talk about right now while we're social distancing, what do you know about doing forensic evaluations in person versus through some kind of technology?
So it's really hard. If you're working for agencies like, or doing evaluations for agencies like Department of Family and Child Services, things like that, they're also social distancing. And so they're using the telephone. And with a lot of populations, as we said, there are some barriers to that, not having internet connections, not even having the technology sometimes. So people are getting creative from what I've seen. And so maybe you stand at the front door, and then there's also handing them paper surveys to fill out and then getting on the phone and getting the information from them based on what they filled out, because you don't want to, you know, handle the paper. So people are just being really creative, and it's a tough, merge, but I've seen a lot of people do it half and half. So maybe if it's a substance abuse evaluation, they either have them come into the office. A lot of times they'll have them come into the office, collect the urine sample, and then try to do the rest electronically. And I know PAR has put out some information regarding how to use the email to administer the assessments. Um, and then with a combination of that and using telehealth, I've seen a lot of people do it that way. But it's just one of those things. It's kind of uncharted, where therapists and the clients themselves are wary and a little cautious and maybe don't want to have that face-to-face contact. So we're being really creative, I should say.
We are, and I mentioned earlier, I'm still seeing some clients in person. So I would be prone to still having them come in and do some of the evaluation in person and do some of it electronically or telephonic. There are a lot of problems if the client is not incarcerated and they're out in the community, for example. If you have them do a test at home, you don't know whether the client is doing that test or not.
Not right.
That's an issue. Now, if you have in your office a room that has a device in it where the client can do the test there, and you appropriately are sanitizing before and after and not coming in with 6 feet contact of the client, et cetera, that might work. Or you might decide that you're willing to do the paper tool, have them sit and do the paper tool, and then you take your disposable gloves and you grab that paper tool and you do what you need with it, and you discard the gloves and you avoid, or you touch the paper and you wash your hands very thoroughly afterwards. You'd have to decide whether you're comfortable with that at this point. But I'm trying to do as much as I can remotely. I'm not comfortable with doing an entire forensic evaluation
Right.
remotely, personally.
And
Uh,
with the jails, some just have these very strict rules that they're not going to allow technology, but sometimes they'll
mhm.
make concessions and allow you to do them in the intake rooms where you're enclosed, so you have some privacy. Um, but the client would be on the other side of the glass. And so it takes longer because a lot of times I'm holding up the tablet or whatnot if I'm using an electronic assessment, or I'm just reading it to them and writing their answers, which, also can affect the responses they give. But, sometimes anything's better than nothing at all.
Somebody's asked the question, is it okay to do a session with a client who's in Canada? So you'd have to know what's the law in Canada. So in most countries, counselors don't even have a license. So somebody can just be a counselor and meet with clients there. In a country like that, I don't think there'd be any problem. That's the majority of countries, by the way. Very few, and for example, in Europe, my understanding in talks with the International Association for Counseling is that there's only one country in Europe that has a license for counselors, and they haven't even started doing it yet, and that's Ireland. I went and visited them last summer and talked to them some about what they're doing in their country. So there's a good chance. Canada, I do not know for sure, though, what the laws are about a whatever type of licensed mental professional you might be. But you just have to find out what the law is. And then not only for Canada, but that province of Canada, what's the law there? And then are you complying with that law? And if anybody knows what the law is, what laws look like for Canada, feel free to put that into the chat box here. Somebody's also asked, is it correct that in order to bill an insurance company for telehealth, you must already been credentialed as a provider for that company? Yes and no. Anyone can bill any insurance company. That doesn't mean you're going to get paid. Some insurance plans have out-of-network benefits. So for example, I'm not in network with Blue Cross, but I do meet with clients who have Blue Cross insurance. I submit claims, and if they have out-of-network benefits, they get a reimbursement from their insurance company for those benefits. So it all depends on that particular insurance policy. Question of our office, or comment maybe, our office has found that several insurance companies want you to use the platform that the insurance dictated, many of which are not HIPAA compliant, which obviously I've declined to use. I have not come into contact with that yet. I have seen insurers require or say, hey, all of our members can use telehealth as long as it's through our Teledoc system. But Teledoc, of course, is HIPAA compliant. So, and it has its own paneled providers for that particular company. But I haven't yet seen an insurance company requiring somebody to use a non-HIPAA platform. That would be a new one for me.
I know
yeah,
Optum
I would not do it then.
I know Optum approves which forms, so they approve Zoom, for instance, but then it's up to you to make sure you're using the HIPAA compliant version.
Yeah. Okay. Thank you. Let's see here. Will you please repeat the name or website for free online intake forms? Yes, it is jotform.com, and it's the Coronavirus Responder Program. Google that, and you should be able, in fact, I'll try to pull it up and paste it into the box in a moment here. But if I can't, just Google jotform.com Coronavirus Responder Program and apply for your free HIPAA compliant plan. Just a side comment, my Aetna clients are benefiting from not having to pay a copay right now. Yes, Angel, thank you for popping that in. And hi, Angel. You're absolutely right that, so my first Aetna telehealth session reimbursement just came in last week, and they said they actually sent a check to the client because I collected a copay, and the client doesn't need to do a copay right now for telehealth. So that was interesting. With criminal justice involved persons, physical contacts not provided in the metro Atlanta area, Georgia probation and parole supervision clients needing assessments and mental health evaluations are being done through Google Meetings video. Okay, interesting. Also, somebody brought up Hushmail. Hushmail is what I use for HIPAA compliant emails. They do have a HIPAA compliant version that is $10 a month, and it is very easy to use. I agree with you, Kim. Karen says Canada does have licensure, and it's fairly strict rules about who can see clients. Not sure what their telehealth rules are. Let's see. Oh, by the way, with Jotform, you can share your forms with other people. So you can make it a template, and then other people can take your form and they can modify it and create their own version of it and things. And so there's also sort of collaboration benefit for some people. And somebody just did the Jotform application while we were talking, and they already got approved in 1 minute. Can students use telehealth for internship? So we do have on the OMCA Open Forum, we have an email from Troy University to their students in a KCREP program saying that KCREP told them that students can use telehealth towards their practicum and internship hours, provided that certain safeguards are in place and so forth. So I can tell you that Troy University put that email out, and that we have it on OMCA's open forum. You can download a copy of it.
Now, that actually, that's a great question, and it brings up a good point. So for people supervising interns or associate licensed clinicians, there's also, and I can only speak for Georgia right now, but supervisors have to have 9 hours of continuing education to do telemental health supervision. So like I said, right now, some of these things are being waived because everything happens so quickly. But just as a general statement towards best practice and looking further along the line, and considering that this may be longer than we hope, you may want to consider looking into some of the trainings. I know that a lot of the boards are waiving the in-person rules or any restrictions on how many hours that of continuing education that you can get uh, virtually. So there are a lot of options out there right now.
I am showing you all, by the way, my iPad right now. And I'm going to pull up that telemental app because some people are confused on how to use it, because it can be confusing the first time. If you open up the app, you start by clicking state guides on the left-hand side, and then you choose the state that you're trying to learn about. For example, I'm going to click Florida. And then you select the type of mental health professional you are. I'm going to select counselor. And then you've got various options, but let's check licensing requirements to see if they have any rules about telemedicine. And yes, in fact, they do in this case. And it provides you the statute here, which you can click on to view for yourself. So that's basically how that resource works. What you'll find is some states do not have any laws or rules that specifically relate to telehealth. But that is the basic way that the program gets used. All right, let's see if there are any other questions, because we do have a few more. All right, so somebody said, be careful and wear a mask. Okay, so I'm gonna say something about the mask. This came up in a few other websites that we did with some licensure boards. There's a good thing and a bad thing about these masks. The CDC is hesitant to recommend using them because most people do not use them appropriately. For a mask to even help, it has to have an appropriate seal and it has to be kept decontaminated. Some people will use an inappropriately sealed mask and they'll feel a little bit more bulletproof, so they'll take they'll expose themselves to more, and it's not really helping for them. Second, they'll take a mask and they'll actually have droplets on that mask because they're not appropriately safeguarding that mask. And then they're actually increasing their risk because the droplets are right here and they're taking them in through an improperly secured mask. For example, a doctor that I recently worked with, he said he saw somebody at the gas station. She reaches in, grabs her wallet, pulls it out to pay for something. Her N95 mask falls on the ground, and then she picks it up and puts it back in her pocket. And he's like, first of all, whatever's on her wallet is getting on that mask. Now whatever's on that ground is getting on her mask. And now she's going to put that on her face and actually make her exposure risk higher rather than lower. So if you're going to be using a mask, then all I can say is make sure you're appropriately trained so you're not actually increasing your risk.
Right. I've seen a lot of guys that with beards wearing the mask, and for instance, if I'm going to wear a mask, I have to shave because I won't be able to get the appropriate seal. It just defeats the purpose.
Yeah, great point. Trying to see if there are any questions we haven't gotten to yet, but it kind of looks like we have. But folks, you have just a couple minutes, so if you have that last question that you really want to get answered, go ahead and throw it in here. So Howard says something is better than nothing. I would agree, unless that something is contaminated and now you're putting it right up on your mouth. So again, it all depends, I would say. That's my opinion anyway.
Hello, everyone. We have another update for you just a couple hours after the live webinar broadcast. There was some information that was put out by the CDC that at least partially conflicts with the information we provided on the webinar about face coverings. The CDC announced that they are now recommending wearing face or cloth face coverings in public settings where other social distancing measures are difficult to maintain. Examples are grocery stores and pharmacies, especially in areas of significant community-based transmission. They talked also about how this strategy could help prevent people who may have the virus and do not know it from transmitting it to others. And they specified that they're recommending cloth face coverings fashioned from household items or made at home from common materials at low cost, and that they are not recommending surgical masks or N95 respirators because those are critical supplies that must be continued to be reserved for healthcare workers and other medical first responders. So Howie brought up an excellent point, and we wanted to make sure that you all got access to this update since we did partially contradict this information during the webinar.
I'm a court clinician. They're trying to set me up with the prisons to do telehealth assessments. Would that be an issue? So if you got to work with the court system, if the court system says the only way to do evaluations is to do it electronically right now, then you do the best you can with what's available to you and you document the way that it was done. And then if somebody wants to challenge your conclusions saying, why didn't you meet with this person in person? All you can say is the only option that was given to me was to do it electronically. So that'd be my thoughts anyway. Could you address doing telehealth from home instead of your office? Is that allowed? I'm aware of no law or rule that, although you have to look at this state by state, I'm aware of no law or rule that says you can't do telehealth from home. And I know many people do it, but you do have lots of considerations. What can the client see? Are there other people nearby? Like people I've spoken to who do telehealth at home have talked about having double doors. Like literally there are 2 layers of locked doors. So their kids, no one else could ever get into that room, possibly hear or see anybody. The client can never hear or see somebody else in the background, complete privacy and confidentiality. Do you have a Ring camera system? Is that Ring camera in your room and someone in your household could listen in on something? These are all things to be aware of. And then boundaries. What does the client see in the background? Those are all examples of considerations.
And they're also making sure your home network is secure. And so when you get into it, there are other connectivity issues. The Zoom team can actually give you information on that. And I've worked with them in the past years ago. And so they were really helpful, but it was a much larger system that we were using it for. And our physicians at the time that were using it were working from home. And so those were some of the additional considerations. So VPNs, things like that can also be beneficial. And I'm saying that to look at further down the line. But, it also helps your clients to feel a little bit more comfortable if they're not so interested in using telehealth. If you remember to remain and keep a professional look. So you don't want to be in like your bathrobe, or even me, I don't typically do my sessions in a t-shirt, again, so just some things to consider, especially if it's their first time using it or if it's a new client.
Now I know we're out of time here, so I'm just one more quick question. Somebody asked about doing in-home assessments. I don't do them. So I guess I could say if you're going to choose to do in-home assessments, which I would think would put you at a much higher risk for COVID-19 exposure, then follow all the precautions you can possibly follow. But I would avoid it personally.
For that, because I do some of that every once in a while. And so I have a tablet that I use for the clients. And so when this started, I haven't done any in the past few weeks, but when it started, I would go to the home, but I would give them the tablet, allow them to connect to my Wi-Fi, and I have my laptop, and I go back to my car. And then we would do the evaluation. Again, it's not ideal, but I was able to get enough information from the person that I could move forward with doing an evaluation, an assessment. It wasn't a full evaluation, but it was an assessment.
All right, folks. Well, on that note, we're going to wrap things up. And in a moment here, you're going to see the survey populate on your screen, hopefully. And if not, then hopefully you've also clicked on the link maybe in the chat box, so it's already opened up on your browser so you can get your CEs for attending today. We do have a webinar next week. We're actually going to have a judge present on the judge's perspective on what makes a good or a bad expert witness. So please go to mbfe.net and select training and register for that event if you'd like. We're going to keep you updated. We might be doing some additional COVID-19 updates down the road here, so keep your eyes peeled. And everybody, my last parting comment would be that to certainly collaborate with your colleagues, turn to each other for some information and support and ideas. And if we stay grounded during this pandemic, then we can pass that sense of stability on to the individuals that we work with. So stay safe, and we'll see you next time. And thank you, Eckham.
Thanks for having me. It was a pleasure.